Causes of subarachnoid hemorrhage include three types: spontaneous, traumatic, and intraventricular and subarachnoid extension from intracerebral hemorrhage. Let's take a look on spontaneous subarachnoid hemorrhage. Spontaneous subarachnoid hemorrhage is a kind of stroke. The main clinical symptoms are sudden severe headache as well as dizziness, nausea, vomiting, consciousness decline, neck stiffness, photophobia, and the other meningeal signs. Thus, when mild, it appears very similar to meningitis. The most common cause of spontaneous subarachnoid hemorrhage in adults is aneurysms. In pediatrics is AVM. In about 15 to 20% of subarachnoid hemorrhage cases, it is not possible to locate the source of bleeding. This may indicate a case of intracranial arteriosclerosis. The most common locations of aneurysms are anterior communicating artery aneurysm. Number 2, internal carotid posterior communicating artery junction. Number 3, tip of basilar artery. Number 4, bifurcation of the middle cerebral artery. Other locations include vertebral and basilar arteries, as well as internal carotid, anterocerebral, middle cerebral, and posterior-cerebral artery. As the bleeding is diffuse in cisterns, it is difficult to define the site of aneurysm without angiographic studies, but there are some helping signs. As in this case of anterior communicating artery aneurysm, we see the subarachnoid hemorrhage in the suprasellar cistern, ambient cistern, sylvian fissure, and the interhemispheric fissure. Also, intraventricular hemorrhage in the third ventricle and the lateral ventricles. There is also dilatation of the temporal horns of bilateral ventricles, reflecting mild hydrocephalus. Also, there is an intracerebral hematoma in the right frontal lobe and hematoma in the septum pellucidum between the bilateral ventricles. These two hematomas provide an important clue of predicting an aneurysm in the anterior communicating artery. The CT angio of this case confirms an aneurysm in the anterior communicating artery. This is the bleeding source of the above subarachnoid hemorrhage, intraventricular and intracranial hemorrhages. The sensitivity of CT scan in picking up subarachnoid hemorrhage is 95% within the first 24 hours, and this drops to 84% after 3 days, and then 50% at the end of a week. If the CT scan is negative, then a lumbar puncture is required to exclude a subarachnoid hemorrhage and in cases with typical history. Where to look for subarachnoid hemorrhage? I mean usual location. The obvious cases of subarachnoid hemorrhage will be found easily on CT. However, a systematic approach is required to identify less obvious cases and to determine early complications, including hydrocephalus, infarction, and hematomas, which may be associated with subarachnoid hemorrhage. Number 1, the interhemispheric fissure. The interhemispheric fissure is the home of anterior communicating and anterior cerebral artery aneurysms. Subarachnoid hemorrhage here is characterized by interhemispheric blood. As you see in this CT, isolated hemorrhage here strongly suggests that the source is anterior cerebral or anterior communicating artery. Number 2, the sylvian fissure. The sylvian fissure is the home to middle cerebral artery aneurysms. It is important to note that the sylvian fissures communicate freely with the central sulcus and the other sulci that run to the convexity of the brain, as shown by the blood in this CT. Occasionally, the blood in the basal part is washed off by CSF turnover, leading to a streak of blood in the convexity sulci only. This is the sylvian fissure, and these are the convexity sulci. The ambient cisterns. The ambient cisterns surround the midbrain and they communicate with the interpeduncular fossa, where the circle of Willis is located. Bleeding into this space could come from several places and is easily recognized by loss of the dark CSF density around the midbrain. As you see in this CT, The black arrows refer to the ambient cistern. Also, the prepontine cistern. The prepontine cistern is a very important location to look for subarachnoid hemorrhage because basilar tip aneurysms make their home here, and hyperdense blood from subarachnoid hemorrhage could be easily obscured by the surrounding bone, which forms the anterior boundary of this cistern. An example of internal carotid posterior communicating artery junction aneurysm. The CT here shows a large amount of subarachnoid hemorrhage and the intraventricular hematoma with hydrocephalus. There is also intracerebral hematoma in the medial half of the left temporal lobe. This picture suggests that the bleeding source should be an aneurysm in the left internal carotid posterior communicating artery junction. And here is the CT angiogram of this case confirms a big aneurysm in the left internal carotid and posterior communicating artery aneurysms.